Imagine waking up one morning and feeling a strange sense that something isn't quite right. Not pain exactly, but an uneasy awareness deep in your bones. It's as if your body is whispering a secret only you can hear. Today, I'm going to reveal 7 of the most dangerously overlooked signs your body may be giving you before serious illness or even death strikes. These aren't myths or dramatizations. These are real, medically backed signals that I've seen firsthand in my decades as a practicing physician. Stay with me, because the sign you're ignoring might be the very one that could save your life. Let me tell you about an old patient of mine, Mr. Das, 78 years old, a kind-hearted man who loved to fix old radios. He came in complaining that he was just tired all the time. He assumed it was normal for his age. He napped frequently, lost interest in his hobbies, and couldn't walk more than a few steps without needing to sit. It turned out he had undiagnosed anemia caused by slow internal bleeding due to colon cancer. That tiredness wasn't just old age. It was a silent cry from within. Fatigue, especially when it's new or worsening, is the #1 underestimated symptom in older adults. Not all fatigue is harmless. If you feel like everyday tasks drain you more than they should, or if you're waking up feeling like you didn't sleep at all, something deeper may be at play. Your heart, your blood, even your brain may be working overtime or failing to keep up. Now let's talk about swelling. Swelling in the legs, feet, or even the hands isn't always just fluid retention or salt intake. I had a patient, Mina, who was proud of how she managed her meals, but when her feet began swelling every night, she blamed her posture or the weather. One morning she collapsed due to fluid buildup in her lungs, caused by her heart's inability to pump efficiently. It was congestive heart failure. We managed to stabilize her, but had she waited another week, the result could have been fatal. Fluid doesn't just sit there for fun. It accumulates when your kidneys, liver, or heart aren't doing their jobs properly. If you notice persistent puffiness, socks leaving deep imprints, or rings getting tighter without weight gain, don't brush it off. Then comes a more subtle sign. Unexplained weight loss. We all want to be a little slimmer, but when the pounds drop without a change in diet or activity, it's time to investigate. I remember Salim, an upbeat retired engineer, who came in grinning. "Doc, I lost 15 pounds without even trying." His smile faded when blood work and scans revealed stomach cancer. He had no pain, no visible signs, just the scale moving downward. Weight loss like that is often the first clue to metabolic disorders, cancers, or thyroid issues. Think of it like a candle slowly burning down. You don't see the fire, but the wax is disappearing. Let's move on to chest discomfort. Don't imagine it always comes in like thunder. For many seniors, it's a soft ache, a pressure that comes and goes, or even just discomfort in the neck, back, or arms. One of my patients, Kana Devi, described it as a gentle squeezing near her shoulder blade. It turned out to be angina, her heart struggling for oxygen. She was a walking time bomb. Here's the deal. Women and seniors often don't experience the Hollywood version of a heart attack. If you're having unusual sensations in your chest or upper body that don't go away with rest, you need to act immediately. Time is heart muscle. Another sign that's easy to dismiss is shortness of breath. "I'm just out of shape," people say. But are you really? If walking across a room, climbing a few stairs, or even talking while walking makes you breathless, something's wrong. In the case of Mr. Ramesh, he blamed his shortness of breath on old age and a dusty environment. In reality, he had blood clots in his lungs, pulmonary embolism, potentially fatal if untreated. Difficulty breathing can point to heart issues, lung disease, blood clots, or even anemia. If you ever feel like you're gasping or can't catch your breath, don't take a wait-and-see approach. Now let's talk about confusion and cognitive changes. We often expect memory slips as we age, but when forgetfulness becomes frequent, or when someone suddenly becomes irritable, withdrawn, or confused, it's not just getting older. I once treated a man named Nalin who began forgetting the names of his grandchildren. His family thought it was early dementia, but imaging revealed multiple small strokes. Each one had chipped away at his brain. Sudden changes in mental clarity, mood, or behavior can be a symptom of a stroke, a reaction to medications, or even infections like a urinary tract infection, UTI. Don't assume mental decline is inevitable. It might be treatable. Lastly, let's address a topic people don't love to talk about: bowel habits. If your stools become thin like ribbons, change color, contain blood, or if constipation becomes chronic, your digestive system might be waving a red flag. I once saw a patient, Parvati, who quietly suffered for months before revealing she was bleeding during bowel movements. She was embarrassed. By the time she spoke up, her colon cancer had spread. Your stool is one of the clearest indicators of internal health. Pay attention to the message it's sending. A change in your digestive rhythm, especially if persistent, needs to be discussed with your doctor. Now here's what connects all these signs. They are subtle. They whisper, not shout. They don't always come with pain, but they point to serious conditions that can often be caught early if you listen. So what should you do if you recognize one or more of these signs? First, don't panic, but don't ignore them either. Start keeping a log. Write down when the symptoms started, how often it happens, and what seems to make it better or worse. Bring that log to your doctor. It gives us more than just clues. It gives us a map to follow. Second, ask questions. Don't settle for vague reassurances. You have the right to understand what's happening inside your own body. Ask for tests if necessary. Push for answers. Third, bring a loved one into the loop. Sometimes we dismiss our own suffering, but a caring child, spouse, or friend can be the voice of reason when we try to tough it out. Fourth, stay up to date on screenings, colonoscopy, EKGs, blood tests, and memory assessments. Prevention is not just cheaper, it saves lives. And finally, take action. Your health is your story's foundation. The better you take care of it, the longer, richer, and more meaningful your story can become. So listen closely. Your body isn't betraying you, it's trying to protect you. Even the most silent signs have a voice. The question is, will you hear it? If this video helped you understand even one new thing, share it with someone you care about. It might be the nudge they need to listen to their own body. Stay informed, stay empowered, and above all, stay alive. I'm Dr. Anand, and I'm here to remind you, your body speaks. It's time to listen.